Egg donation. Egg donation is an in vitro fertilization treatment where the eggs are from a donor. It can be divided into several phases: selecting and synchronizing the donor. Egg donors are young women who decide to donate their eggs in order to help other women who need them. To become an egg donor, there are some tests that need to be done in order to make sure she is a healthy person, both physically and mentally. In Barcelona IVF, the egg donor's selection is done individually by our medical team, always keeping in mind the partner's physical characteristics to guarantee a greater compatibility. Once the donor is chosen, we continue with the synchronization of the cycles, so we can perform the treatment at the same time and use the donor's eggs. Ovarian stimulation and endometrial preparation. While the donor is performing the ovarian stimulation, the patient must prepare her endometrium. Medication is administered so the endometrium thickens to a size that will allow us to perform the embryo transfer. Some days after, an ultrasound scan is done in order to confirm it is growing. From this moment on, the patient will have to wait until the donor's egg collection is done. Egg collection, fertilization, and embryos culture. The donor's eggs are obtained through an egg collection, and they are analyzed in the laboratory in order to fertilize them. About 4 to 5 hours after, a sperm is injected into each egg, and they are left in culture in an incubator that keeps the greatest conditions for their development. After 18 to 21 hours, we check the eggs are correctly fertilized. The obtained embryos are kept in culture until they achieve the Blastocyst stage, which means a 5 days old embryo. Embryo transfer. The day of the embryo transfer, the patient must have a consultation in order to be informed about the embryo's state. She decides the number of embryos she wants to transfer and goes to the embryo transfer room near the laboratory. The embryo transfer is a simple procedure that does not require sedation. A catheter is introduced into the uterine neck to place the embryos into the right spot. This procedure is done by using an ultrasound scan, which allows us to see where we are going to place the embryos. Right after the transfer, the patient can go back to her home and carry on a normal life, avoiding intense physical efforts and risk activities. 12 days after the embryo transfer, the pregnancy test will be done to confirm whether the patient is pregnant.